Today, let's talk about pulses. We'll work our way from the head to the toes first. The first one is your temporal artery. It is bilateral. You're going to check with the pads of your fingers on the right side as well as the left. Next is the carotid artery. It is bilateral, but we only check one at a time. If we check both at the same time, it will cut the circulation off to the brain and the patient will pass out. To check this, use the two pads of your fingers on the right, two fingers on the left. Working our way down, we have our brachial pulse, which is right here in the crevice of the elbow. You're going to use the pads of your fingers, and it is also bilateral. Next are the radial and ulnar pulsars. You have one here on the left, as well as the right, and bilaterally on the other hand. Moving from the extremities to the trunk, we have the PMI. This is the apical pulse. It is going to be fifth intercostal space, mid-clavicular, using the two pads of your fingers. Working our way down to check the femoral arteries. Keep in mind to not expose your patient. On the left side of the thigh, on the inner side, we're going to use two pads of our fingers, as well as their right side. Next is the popliteal. That is behind the knee. It's also bilateral. Here you're going to use two hands, pads of your fingers, behind the kneecap, and hold the knee. The last two pulses are located on the feet, bilaterally. Here it's the dorsal pedis, as well as the posterior tibialis.